Why do some patients suffer from chronic versus occasional constipation? Have you ever wondered why some people deal with constipation all the time while others only face it occasionally? Constipation means having infrequent, difficult, or incomplete bowel movements. The key difference between chronic and occasional constipation lies in the underlying causes and how long the symptoms last. The colon, also known as the large intestine, plays a vital role in our digestion. It absorbs water and electrolytes from stool and helps push it out of the body. For normal bowel movements, we need coordinated muscle contractions, enough hydration, fiber, and proper nervous system function. When any of these factors are disrupted, constipation can happen. Occasional constipation is often temporary. It can be triggered by factors like a sudden change in diet, low fiber or fluid intake, dehydration, stress, travel, or certain medications. Usually it resolves with simple lifestyle changes like eating more fiber, drinking more fluids, and getting regular exercise. The colon's function remains mostly intact, and symptoms are short-lived. On the other hand, chronic constipation is more complex. It lasts for several weeks or longer and can indicate deeper issues affecting colon health. Some patients experience slow transit constipation, where the colon muscles do not contract effectively, delaying stool movement. This can be due to nerve or muscle problems in the colon wall. Another reason for chronic constipation is pelvic floor dysfunction. This occurs when the muscles involved in bowel movements do not coordinate properly, even if the colon itself is functioning normally. Additionally, underlying medical conditions like irritable bowel syndrome, hypothyroidism, diabetes, or certain neurological disorders can lead to chronic issues with bowel function. Structural problems in the colon, such as strictures or tumors, can also block stool passage. Furthermore, long-term use of medications like opioids or anticholinergics can cause persistent constipation. Changes in the gut microbiota or the balance of bacteria in the intestines may also play a role in chronic constipation. Chronic constipation can have serious implications for colon health. It may lead to prolonged stool retention, increasing the colon's exposure to irritants and toxins. While occasional constipation is usually not a concern for colon cancer risk, persistent constipation with inflammation or structural changes should be evaluated by a healthcare professional to rule out serious conditions. For those with occasional constipation, symptoms can often be managed through dietary changes, increased hydration, exercise, and stress management. However, if someone experiences chronic constipation, it is essential to seek medical advice. This may involve diagnostic tests like a colonoscopy to rule out any serious issues. Treatment options can include medications to improve motility, biofeedback therapy for pelvic floor dysfunction, or addressing any underlying medical conditions. Maintaining colon health is crucial. A balanced diet rich in fiber, regular physical activity, and routine screenings can help prevent complications. Understanding the differences between chronic and occasional constipation is key to managing symptoms and maintaining overall digestive health.